Hi, I'm Dr. Bhargav Raut from Pathofast Lab, Pune. If you have been experiencing stomach pain on the right side of your stomach, together with other problems like you feel like vomiting, you feel tired all the time, you may be running a fever, or your eyes have gone a little yellow, your doctor may have advised a test called the SGPT or ALT test. And today's video is all about this test. So first of all, let's come to what is the SGPT test. The SGPT slash or also known as ALT test is actually a blood test that checks for the level of an enzyme which is normally found in your liver. Now this enzyme is found generally only in the liver, but also in small quantities in a few other parts of your body like the skeletal muscles or the heart, but by and large it's only present in the liver. Now the full form is a pretty long word which I've included in the slide to my left. But what you need to understand is that this enzyme is normally present inside intact cells in your liver. That means if anything damages your liver, this enzyme is going to leak out of those damaged cells and show up in your blood, and that's how we detect it in the blood test. So what are some symptoms that you might experience because of which you might need this test? So some of the most common symptoms that are seen in patients who need an SGPT test are things like jaundice, which is basically yellowing of your eyes or your skin or your urine. The second is a loss of appetite where you don't feel like eating anything. The third is pain on the right side of your abdomen, a little high up. And the fourth could be constant tiredness or fatigue. All these are signs of some kind of infection in your liver, and that is the thing that we try to detect through this blood test. So when is the SGPT test done? What does it help us to find? So the most important things that it helps us to find are any kind of liver damage, anything wrong with your liver, any damage to your liver, and the SGPT level is going to rise. The second is fatty liver, where fat gets deposited in your liver. This is usually happens in overweight people. It damages the liver, and a raised SGPT is usually a sign of that. The third is viral infections. Now there are some viruses which commonly infect the liver, like the hepatitis B, C, D or A viruses. All of them cause an elevation of the SGPT level, and so we can detect it by measuring this level. The fourth is people who drink a lot, and the last is those who are on medications for a very long time, because both these things damage the liver and tend to elevate the SGPT level. How is the SGPT or ALT test done? Well, this is a simple blood test. You don't need to fast. There is no special preparation. The lab in charge or the lab technician or a nurse will simply collect a few ml of your blood by inserting a needle into your vein. After this is processed in the lab. They usually do this in the Department of Biochemistry. I've mentioned the units and the principle of measurement in the slide, but all you need to know is this is just a simple blood test. There's nothing very complicated about it, and you'll usually have your reports on the same day or on the next day. What is the normal range of the SGPT or ALT test? The normal range is in adult men is usually between 29 to 33 international units per liter, and in women it is considered to be between 19 to 25 international units per liter. As a rule of thumb, we consider the normal SGPT to be up to around 30. Now, what are the reasons because of which you might have an abnormal SGPT test report? So there are some very specific reasons because of which the SGPT level goes up, and I've mentioned them here. An increased level is generally found in one of four situations commonly. First is viral hepatitis, where a virus like hepatitis A, B, C, D or E infects your liver and damages it. Second could be cancers. The cancer is usually somewhere else in the body. It travels into the liver, it sits in the liver and starts damaging the liver, and that causes the SGPT level to rise. The third is those people who drink a lot, and the fourth is maybe the most common today, fatty liver, where people are overweight or obese, and this fat is stored in the liver and it damages the liver, raising the SGPT level. And the last is people who are on chronic medications. There are a few other slightly less common causes, which are autoimmune hepatitis, chemical injuries because of overdosing on certain medicines, and also a very few rare but very dangerous situations where the blood supply to the liver is blocked for some reason, and that causes massive liver damage and it causes your SGPT level to rise. A low SGPT level may actually be found where the liver has completely failed or the kidney has failed. These are very rare, they are not generally seen, and it's not something that doctors are looking for. Most of the times we are trying to find reasons for which your SGPT has gone up, and these are the most common causes. What is a dangerous SGPT or ALT level? This is a very common question that is asked by patients. So I've mentioned a list of all the levels to my left. The most important is that anything which is less than twice the upper limit. So the normal range for the SGPT is, as we've mentioned in the earlier slides, it's usually less than 30 or 35. So anything which is less than twice the normal, which is like less than 70, is considered to be borderline, and this is generally not given much importance because it usually comes back to normal. The next is when the level is 2 to 5 times above the normal range. Now that is between 70 to 150. This is usually called a mild elevation. The next level where things begin to become more and more dangerous is when the level is between 150 to 450, which is 5 to 15 times above the normal level. This is what we call moderate elevation. In this, there are again two segments, those where it is more than 200 and those where it is less than 200. So when it is more than 200 but less than 450, we call that something which has recently impacted your liver. There has been a recent cause of damage to your liver. Less than 200, it would be something which has been going on from a long time, and these are usually hepatitis B and C viral infections. Then we go from 450 up to 10,000. Now these are called severe or rather massive elevations of the SGPT. They are seen when it is more than 1,000. It is usually because of overdosing on medicines or because of a blockage of the blood supply to the liver, but this is very variable. It can also be seen in early viral infections. It can be seen in all kinds of serious situations. So there's no hard and fast rule that says more than 1,000 means a certain cause. Anything above 450 is very dangerous. Actually, anything even above 70 is dangerous. Any elevation of the SGPT must be investigated, but this is a by and large a breakdown of what are the high levels, meaning more than 10,000 is called massive elevations. These are usually only seen when there is a blockage of the blood supply going to the liver, which is a medical emergency. So these are all the different stratifications of the dangerous levels of SGPT. What is the price of the SGPT or the ALT test? Well, in India, the price usually is around 120 rupees. This is a very broad range. I'm not saying this will be the situation in your city, but in my city, in my lab, we charge 120 rupees for this test. It is usually included as a part of the complete liver profile, and for that we charge around 1040 rupees. What are some natural foods with which you can bring down your SGPT? Now, please note that these are only applicable if the cause of the elevation has been sorted out and treated. These foods only help your liver, they protect your liver, but they will not solve the actual problem, for which you definitely need to consult a doctor. So some foods are things like green leafy vegetables, like for example, like spinach. You should have a lot of raw fruits. Garlic and turmeric also known to help, as well as whole grains.